My first patient of the day today was pretty interesting. It was treatment of a recurrent seroma. So seroma is a fluid collection that forms after surgery. And when you have a fluid collection right after surgery, you can sometimes just drain it and it won't come back, or drain it a few times and it won't come back. But if you leave the seroma for a long period of time, your body will wall it off with scar tissue, and we call that a capsule. And it's the same process as if you have an implant. Now, once a capsule forms, it's a lot more complicated to get rid of the seroma because that capsule tissue doesn't absorb fluid as well as your regular tissue does. And so you have to do something to that capsule. The two somethings that are commonly done is you can inject a sclerosing agent or something that is irritating to the capsule to try to get it to seal shut. The other option, which is more aggressive, is a surgical option where you go back in surgically and remove that capsule. For this particular patient, another surgeon had already tried to remove the capsule, and the seroma came back. And he told her that he just couldn't get deep enough. He thinks maybe he didn't get the whole thing. So when I went in there today, that is exactly what I found. He had removed about this much of the seroma cavity, but this much down deeper was still there. So I could see like the demarcation of right where the end of the capsulectomy was and just a thick capsule underneath. So I went spelunking and I got in there with my headlight and some long instruments, and I was able to remove the entire capsule. The next thing I did is I sutured the tissue down with progressive tension sutures. So I wanted to reduce the space that fluid could collect. So I used some dissolvable stitches and I sutured all of that tissue down. So after surgery, there's two things I do to try to further increase the chances that this work. I put her in a compression garment, so something that keeps the area flat to hopefully prevent fluid from accumulating so it scars down quickly. And then the second thing is I start them on a medication that reduces fluid production. All of these things together tend to do the trick with difficult seromas like this.